Aspiration pneumonia. Definition: pneumonia is a breathing condition in which there is swelling or infection of the lung or lower airways. Aspiration pneumonia occurs when food, saliva, liquids, and vomit is breathed into the lungs or airways, leading to the lungs. Next, we had a video.
Pneumonia is inflammation in your lungs caused by an infection. You have two lungs, one on each side of your chest. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon, and when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli.
So continue. Applications in medicine. The following tests may also help to diagnose this condition: arterial blood gas, blood culture, bronchoscopy, chest X-ray, complete blood count, CT scan of the chest, sputum culture, swallowing test. Next video.
Hi, this is Dr. Karen Becker, and today we're going to discuss aspiration pneumonia. Aspiration pneumonia is also called inhalation pneumonia, and it's a condition of inflamed and infected lungs caused by inhaling or aspirating substances. That includes vomit, food, foreign bodies, and regurgitated gastric acid. The severity of this condition depends on what material has been inhaled, what bacteria is present, and the distribution of the aspirated material into the lungs. This condition is more common in dogs than kitties, and newborn puppies have a higher risk of aspiration pneumonia, especially if they're bottle fed or have a cleft palate.
So continue. Pros, cons, lung access, shock, spread of infection to the bloodstream, spread of infection to the other areas of the body, respiration failure. Some people may need to be hospitalized. Treatment depends on how severe of pneumonia is. Sometimes ventilator is needed to support breathing. More severe infection may result in long-term damage to lung. Pros: good prognosis depends on health to the person before getting pneumonia, type of the bacteria causing the pneumonia, how much the lungs are involved. Next video.
Hello, John Goulet here from the University of Alabama at Birmingham to talk to you about using bedside ultrasound to evaluate for pneumonia. There's no specific technique to scanning for pneumonia. One simply scans through the intercostal spaces between the ribs to look for the signs we're going to demonstrate. However, a careful and systematic approach to scanning the large surface area of the thorax must be employed in the absence of localizing data. If, however, one has localizing information such as focal pleuritic pain, unilateral decreased breath sounds, a questionable finding on a chest radiograph, and so forth, you can focus the exam in that area. Furthermore, the lung bases will be the site of many consolidations and should be examined with particular attention. Use a low-frequency transducer such as the phased array or curvilinear probe. These will provide adequate depth for looking into the thorax. As we know, normal healthy lung is mostly...
So continue. Disease: lung access, shock, bacteremia, sepsis, respiration failure.
In a previous lecture, we learned about two important diagnostic tools, which are history and physical exam. History of our imaginary patient is suggestive of pneumonia, and physical exam reveals strong high hand raise. Percussion returns a third sound. Now it is time for us to use the third diagnostic tool, which is imaging. So we'll get a chest X-ray done, and depending upon the findings of the chest X-ray, we may have to use CT scan or ultrasound may be used.
So thank you. Aspiration pneumonia.